be the healthiest. They're not. They are only getting sicker. Drugs don't make you healthy. They may reduce or alter your symptoms, but that does not make you healthy. What makes you healthy then? Life makes you healthy. Having 100% life flowing through you, having a body free from interference so the energy from your brain can travel freely to every part of your body is what health is all about. And that's the goal of my office, to let 100% of your God-given potential flow through your body 100% of the time. I mean, look at the sick, old people around you. Do you think that consciously and willingly they gave up overnight? The vibrancy in their step, the glow in their eyes, the energy in their being, the silent weakening, wearing down and stiffening of their lives did not occur suddenly, but happened slowly, ever so slowly. No one wakes up suddenly older, but it happens slowly. And when it does happen, we have to make a choice, to change or die. Too often we make no choice, and that's our choice. But today is different. Today you are going to make a different choice, to become healthy naturally, letting your body heal from above down, inside out, to become all that God wanted you to be, to let life flow from the brain to the body at 100% all day, every day. So I want you to pick up that phone right now and make a change. That number to our main office in Shelby Township is 586-997-4086. That's 586-997-4086. Now, the next 10 callers will receive an exam, a consultation, including an x-ray. So that number, one more time, is 586-997-4086. And if you get our answering service, leave us a message. We will return the calls in the order that they are received. So thank you for tuning in to Maximize Living. I am your host, Dr. Chad, and we are talking about what true health is and how to obtain it. Now, I want to talk to the baby boomers out there right now. I know you want to be as healthy as you can for as long as you can. You're working out, you're eating right, you're taking supplements, you're on the right track. And properly cared for, some experts believe the human body is designed to last up to 120 years. Proper nerve system control of your body won't make you a teenager, but it can help you stay active and enjoy life. Many athletes seek our care because they know their nervous system is the most important system of your body, and it improves athletic performance. Even if you're not an athlete, a properly functioning nerve system is essential if you want to be and do your best. Just as periodic dental checkups can help detect the early signs of decay before painful symptoms, regular nerve system checkups can help identify and correct little problems before they become more serious. Now, I brought a study with me to discuss with you today, so I want you to pay close attention to what the findings were. The University of Pennsylvania gave a medical doctor, Dr. Windsor, permission to carry out his experiments. And what he did was he dissected 97 cadavers, finding 221 diseased organs. Now, he wanted to know if there was a relationship between diseased organs and nerve system interference. Well, Dr. Henry Windsor, of the 220 diseased organs, 212 were observed to belong to the same nerves coming out of the spine. In other words, Dr. Windsor found nearly 100% correlation between the nerve system interference and diseases of the internal organs. Now, some of the diseases and the related nerve system were stuff like heart disease, lung disease, stomach disease, liver disease, gallstones, pancreas, kidney. The list goes on, but Dr. Windsor's study actually gives weight to the claim that nerve system interference that interfere with the body function and will have a profound impact on internal organ health. Now, the main question is, I want to ask you, are you connected to your body? The nerves connecting to your internal organs to your nerve system must remain free of interference. If these nerves are stressed or impinged because your nerve system is not able to work at 100%, your health will suffer. You may not know it or feel it right away, but if you have nerve system interference, your internal organs are slowly weakening and eventually malfunction and eventually becoming diseased. Now, we're going to take a break, and when we come back, I'm going to introduce you to one of my colleagues, Dr. Derek Bittner, when we get back, so stay right there.
Personal foul? Inactive activities on a glorious day.
Huh?
Let's get out there and play!
Sweet.
Ooh, freeze!
When do I get to be in? Uh-oh.
Hey, Reggie, frozen people can't talk.
PLA!
An hour a day.
I'm in. There are lots of great play ideas online, but don't stay too long.
I think it breaks a little to the left.
To the right.
Nope, straight.
I told you it was going right.
Get up, get up, get up, and be a player. Get up, get up, get up. Get up, get up, get up, and be a player. Get up, get up, get up. Get up, get up, get up, and be a player.
Get up and play an hour a day.
For fun playtime ideas, go online. Just don't stay long.
Hello again. My name is Dr. Chad McKernan, and you are watching the Maximize Living Show. Now, I want to bring on a special guest that we have with us today. His name is Dr. Derek Bittner, and he has one of the largest practices in Sterling Heights and has a lot of experience in dealing with the problem cases that some doctors just can't seem to help. So welcome to our show today, Dr. Derek.
Well, thanks for having me, Dr. Chad. Appreciate it.
No problem. We were just talking about the Windsor autopsies, which was done by a medical doctor looking at the relationship of disease and the nervous system. And my question to you is, what exactly does this study tell us about what true health is, and how does disease develop?
Dr. Chad, I mean, it's everything that we talk about. It's talk about how the nerves control every organ in the body, how the brain sends a message down the spinal cord. And when those nerves become damaged and interfered with, and I think you talked about that word subluxated, that it destroys those organs. And Dr. Windsor went through there and did the studies on about 100 cadavers and found over 90% ratio of disease compared to those organs.
Right.
And this is exactly what Maximize Living doctors we've been doing for the last 100 years, is saying the same exact thing. Destroying the nerves will destroy the organs.
Okay. So you're finding that these subluxations, I mean, in your office too, I mean, what is the prevalence of the people that are walking in with, I mean, different types of disease processes, not only neck and back pain, but, I mean, visceral diseases or symptoms? I mean, what are some of the latest disease processes that you've seen walk in your office just this last week?
Well, I mean, just this last week, this week in kids, we've saw ear infections. We've seen chronic asthma. Kids on 7 medications. I mean, it's 4 years old, 7 medications the night before she comes in my office.
Wow.
I mean, and this was about 2 weeks ago she was in the office, and within under a week we've had her off all of her medications. Okay. And the scary thing is that her mom works for the medical doctor.
Wow.
She's actually the office manager.
Wow.
And so, you know, we see these young kids coming in with chronic problems already. We've seen adults with digestive disorders, chronic liver problems. I mean, so many things that are being traced right back to the nerves.
Okay.
The nerves that come out of the spine in there. Even seniors, we see great, you know, pain that they're having going down the legs, their arthritis decreases. I mean, these are things that we see every week in our office.
Wow, that's awesome. And, you know, it's funny that you mentioned the liver, chronic liver problems, because we just had a lady come into our office not too long ago, and she was having chronic liver problems. I mean, her liver was actually shutting down. She was in and out of hospitals since 2006, you know, trying to find out why her liver was dysfunctioning. And she went to the doctor, her doctor, and the diagnosis she received was cirrhosis of the liver. And it was getting so bad that she had 4 blood transfusions, and her doctor wanted to put her on the liver transplant list. So she came into my office and she wanted to know, you know, if a Maximized Living doctor could help her. And I said, if you have nerve interference that's going from the spine to the liver, that liver is going to dysfunction. Well, we did a thorough exam, did a nerve system scan on her, took a detailed x-ray, and sure enough, I mean, she had a subluxation in that area of the spine. So lo and behold, we adjusted her for 90 days. We put her on 1 supplement to boost her body and her immunity, and her liver is almost back to normal.
That's amazing.
I mean, she is ecstatic, and I mean, the prognosis for you know, liver transplant is about 50%. I mean, you have a 50% chance of living or dying for 10 years after the surgery. So, I mean, just a dramatic, life-changing experience with her. But I mean, that's just, I mean, one of the miracles. I mean, do you notice that most of the people that are coming into your office are on some type of drug or medication for these diseases?
Oh, more now than ever.
Really?
More now than ever. You know, we see it younger. We see it even younger and